Good afternoon. Today I'm going to talk about respiratory disease and ways we can manage it with diet. So, respiratory disease is a very common condition in the United States, affecting millions of people every year. According to Healthy People 2020, there are 25 million people with asthma and 14.8 million people diagnosed with COPD. Respiratory disease affects any part of the respiratory system: the trachea, the bronchi, the lungs, and any other part of the respiratory system, and it reduces its effectiveness. This can be because of inflammation, fluid buildup, or any other number of issues with it. There are treatments available, but diet can play a vital role in helping to improve quality of life and reduce mortality in people with these types of diseases. So there are many types of respiratory diseases. Some common ones are bronchitis, emphysema, cystic fibrosis, pneumonia, and tuberculosis, and of course chronic obstructive pulmonary disease, which is one of the ones I'm going to focus on today. That's caused by lung inflammation, specifically in the bronchioles and the alveoli, which inflammation in these areas can greatly inhibit gas exchange that's necessary to function properly. It restricts breathing. It's mainly caused by smoking. That's the leading cause, but it can also be caused by other conditions such as emphysema and bronchitis. So one of the problems we can see with COPD is a reduction in lean body mass. So acute exacerbations from COPD may cause a lower calorie intake and a higher calorie expenditure, and this can obviously cause a calorie deficit where people can lose muscle and weight in general. So the obstruction in the lungs can increase breathing difficulty, and it can increase resting calorie expenditure and decrease oxygen. It can decrease the efficiency of how our bodies use oxygen. Also, cytokines in the body can reduce appetite and increase metabolic rate. So all these things can contribute to a lower lean muscle mass, lean body mass. So one approach to try to help this issue is to increase protein to 1.5 grams per kilogram per day in these people, to try to restore as much lean mass as possible, and also have them eat energy-dense foods that help them to maintain their muscle mass. Another issue is respiratory quotient. So for one molecule of carbohydrate that a person eats, one molecule of CO2 is produced. That would be a respiratory quotient of 1. And a major issue is when patients have CO2 retention. So carbon dioxide is a metabolic waste product that we have to breathe out. So if we can't get rid of it, these people that have CO2 retention can't get rid of it properly, adequately, and it builds up, causing systemic acidosis, which lowers aerobic capacity and causes more difficulty in breathing. However, fat and protein have respiratory quotients of 0.7 and 0.8 respectively, which means that they don't cause the body to produce as much carbon dioxide they don't cause the body to produce as much carbon dioxide, so they have a lower respiratory quotient, which suggests that if we have someone eat a diet that's higher in fat and lower in carbohydrate and maybe moderate in protein, that they won't produce quite as much carbon dioxide. So if they do struggle with CO2 retention, that it won't be as much of a problem. However, high protein is not necessarily recommended because it has a higher thermic effect and it causes the breathing rate to go up, so that can cause more issues with breathing. Another issue we see in general respiratory disease is oxidative stress. This is caused by reactive oxygen species, which is an oxygen molecule that is unstable and is missing an electron, so then it has to take an electron from other molecules in the body that may be important for our body. It can be caused by environmental factors such as pollution, but it can also be caused by natural inflammatory responses in the airways. So the way we can fight this is through antioxidants. And what these antioxidants do is they help to stabilize the ROS, the reactive oxygen species, by giving the ROS the needed electrons that it's trying to take. So these can help stabilize it so the reactive oxygen species doesn't cause as much damage. Some sources of antioxidants are vitamin C, vitamin E, flavonoids and carotenoids. And we can get these from fruits, vegetables, nuts, vegetable oils, cocoa, red wine, green tea, and all those different things can help to neutralize the reactive oxygen species because they're antioxidants, and can reduce inflammation and help people with respiratory disease as well. So these are just a few recommendations, and these recommendations only scratch the surface of applications for diet on respiratory disease, and there are very many other types of respiratory diseases and problems they can cause. But overall, nutrition can be complicated, but we can simplify it with some general recommendations. First of all, something that's recommended for a lot of different types of diseases and conditions is the Mediterranean diet. This includes low saturated fat foods, healthy fats and oils, lean meats like chicken and other meats like fish that have healthy fats in them, and just a very small amount of processed food and refined sugars, and also low sodium. So this will help with all kinds of conditions, heart conditions. Also, the antioxidants will help with respiratory disease. And just to focus on fruits and vegetables and supplements if needed. So hopefully these recommendations give a good glimpse into how we can help improve quality of life for patients who have respiratory disease.